The Democrats have been getting what they want. First of all, what they wanted was the infrastructure bill, control of it. In other words, the first part of the infrastructure bill, which is the American Rescue Plan, which has to do with the roads and bridges and highway and Wi-Fi, they want to make sure that that $1.9 trillion budget was approved with bipartisanship. So they made sure that they had enough Republicans and enough Democrats to come on board to get that approved. But yet, during the same week, the Democrats were able to pull off in the Senate as well the $3.5 trillion American Family Plan. So they were able to do that as well.
Breaking overnight, hours after passing a major infrastructure bill with bipartisan support, the Senate took another big step to push through President Biden's agenda. It narrowly approved a $3.5 trillion blueprint for family and environmental programs. Much of that would be paid for with higher taxes on wealthy Americans and corporations. Chris Van Cleve is on Capitol Hill for us. Chris, good morning to you. What's next?
Tony, good morning. Now they have to take this framework and turn it into an actual bill. And what's inside that bill is going to be crucial to passing not only the Budget Act, but also this infrastructure bill they agreed on yesterday. If they manage to do that, they will deliver on many of President Biden's promises, but the road ahead could be rough and long.
The yeas are 50, the nays are 49, and the concurrent resolution as amended is agreed to.
This morning, the Senate approved a $3.5 trillion budget resolution, setting the framework for a massive budget bill loaded with progressive social programs, including child and senior care, and money to combat climate change. The 50-49 party line vote came after an overnight vote-a-rama on a lengthy series of non-binding amendments.
This amendment is just plain anti-pickup truck. Let's start there.
Opposing my amendment is a vote in support of defunding the police.
Some senators expressed exasperation at the procedure.
So let all of us, 100 people, not walk, but sashay down there and vote for this amendment.
But earlier Tuesday, bipartisanship briefly reigned as the Senate overwhelmingly passed a $1.2 trillion infrastructure bill.
On this vote, the yeas are 69.
19 GOP senators joined Democrats in voting to rebuild the nation's highways, bridges, public transit, and expand access to broadband.
After years and years of infrastructure week, we're on the cusp of an infrastructure decade that I truly believe will transform America.
Tennessee's Bill Hagerty voted no. They call the infrastructure bipartisan, but
I think what it reveals is the strategy deployed by the majority leader. He wanted to put the patina of bipartisanship on this initial package. He wanted to create a series of actions, real momentum toward this $3.5 trillion spending spree that's going to be a debt bomb for America.
The infrastructure measure heads to the House, but Speaker Nancy Pelosi won't allow a vote until the Senate passes that $3.5 trillion budget bill.
The total vision is about not only building physical infrastructure, but building human infrastructure.
And now Speaker Pelosi plans to call the House back from recess early. They're expected to be back here August 23rd. That's about a month early, where they will take up the House version of that budget resolution and possibly voting rights.
So now, as I mentioned before, the Democrats have the control of the first bipartisanship, $1.9 trillion, as well as the nonpartisanship with the reconciliation with all 50 senators, the $3.5 trillion American Families Plan. And that plan definitely centers around helping young people, helping seniors, helping those in education, as well as other programs that'll be coming down the turnpike. So therefore, it may be another stimulus plan. It may be another stimulus check. We don't know, but we know that it may be even more relief money for those that are in need right now because they understand what's taking place with families.
So what is in the bill? What are we doing? Well, let's start off by looking at the youngest people in America, our children. We as a nation shamefully have the highest rate of childhood poverty of almost any major country on earth. Well, you know what? We're going to address it. We're going to address that in a number of ways. Number one, we're going to pass a child tax credit. That means if you're a working class family, loosely defined, and you have a child, for every child under 18, you will get $300 a month from the federal government to help you raise that child. And we think that that will, which is basically what goes on around other industrialized countries around the world. So it's not a radical idea, not a new idea. but it will reduce childhood poverty by 50%. What do you think about that? Reduce childhood poverty just by doing that. And in addition, for children, what we're going to do, and every parent out there knows this, we have a totally dysfunctional child care system. It is outrageously expensive. Workers in child care get paid starvation wages. We don't have enough locations. Many people in America literally cannot find a slot for their child. So we're going to deal with child care in a very profound way and make hundreds of billions of dollars investment to lower the cost of child care for working families. The goal is no family would pay more than 7% of their income, which is far less than they're paying right now. And we're going to make sure that child care workers receive living wages and see it as a career, not just as a low-wage job. What we're also going to do is address the many crises that we have. All of you know, and I've ranted and raved about this one for years, we pay the highest prices in the world for prescription drugs. Pharmaceutical industry is enormously powerful. We are going to have, for the first time, Medicare negotiating prescription drug prices with the pharmaceutical industry. And we think we can raise as much as $500 billion in doing that and lower prescription drug costs throughout the country. What we're also going to do is expand Medicare to finally cover dental care, hearing aids, and eyeglasses. It is simply crazy that for many, many decades now, Medicare was passed in 1965, and somehow at that point they didn't think that dental care or hearing or vision was an issue. Well, obviously it is, and we're going to put that in there so that senior citizens in this country will be able to go to a dentist, to get the hearing aids they need, get the eyeglasses that they need. We are also going to make sure that we have doctors, enough doctors and nurses and dentists in this country. One of the crazy things in our dysfunctional system is not only do we pay the highest prices in the world for prescription drugs, but despite that, we don't have enough doctors in many parts of this country. We don't have enough mental providers in this country. Doctors who are working on women's health, primary care physicians, doctors in rural areas, doctors in underserved urban areas. So we have a program in here which will train more and more doctors and nurses and dentists and get them into underserved areas.
Every time we've had a stimulus bill or a stimulus package in the last 2 years, it looks like the American public, us, we're the ones that have had to pay for it. Well, this go around, the Democrats want those that are rich to pay for it. They want the mega rich who've made so much money doing this to make sure that they pay their fair share into this. And the next thing that the Democrats are in control of, even though these two bills passed in the Senate, they're on their way to Nancy Pelosi and the House of Representatives. And the House of Representatives have already said if it had not passed, meaning that $3.5 trillion stimulus package had not passed this week in the Senate, then they would have just sat on that $1.9 trillion American Rescue Plan until the other plan had gotten approved. So therefore, since both plans have already been approved, this